Very good day, children. Today we are going to see the continuation of the lesson 3, reproductive health. So earlier we have seen the topics up to 4, the population explosion and birth control. And today we are going to see the continuation of the topics like the medical termination of pregnancy, what do you call it as MTP, and the sexually transmitted diseases, STT, and infertility, assisted reproductive technologies, ART, and detection of fetal disorders during early pregnancy. So these are the topics which we are going to see today. Let's get into these topics. Medical termination pregnancy, that means MTP. Here, this is a method of abortion that is a voluntary or intentional termination of pregnancy in a non-surgical or non-invasive way. So, early medical termination is made possible from say up to 12 weeks, that is the first trimester of pregnancy. So, generally this has no impact on the women's fertility. And another one, abortion during the second trimester is very risky. So what happens is that the fetus become intimately associated with the maternal tissue, that is with the mother's blood circulation, which is very dangerous. The next one is the sexually transmitted diseases, the next topic. It is otherwise called as venereal disease, VD, or reproductive tract infections, RTI, which are collectively called as the STI or sexually transmitted infections. Normally, this is transmitted from person to person during intimate sexual contact mostly, which are passed on from an infected person. And infections like hepatitis B and HIV, they are also transmitted sexually mostly. And here also by sharing infusion needles. You can see in the picture by the infusion of the needles, surgical instruments with the infected people, and also the blood transfusion or from the infected mother to the baby, this sort of diseases are passed on. And the next one we can see the bacterial STI. Or the number one, gonorrhea. You can see the picture here, the gonorrhea, syphilis, chancroid, chlamydiasis, lymphogranuloma, venereum. So all these are the bacterial STI, and viral STI or genital herpes, genital warts, hepatitis B and AIDS. Fungal STI, you can see the picture here, the candidiasis, you can see the chunk that is showing the symptoms here, and also the protozoan STI, trichomoniasis. This is commonly seen in all the females and males in the genital tract or even in the mouth, something like that. The next one is this is the STI. We can say it is it can be treated with the antibiotics or by other medicines except virus, which cannot be treated with the symptoms that can be controlled. You can only control the virus causing infection by antiviral medications. Otherwise, you can go for antibiotics and other medicines in other cases. The next one is how to prevent this STDs. To prevent this STD, mainly you have to avoid sex with the unknown partner or multiple partners. So that is number one. And another one, use of condoms. Number 2, and another one, in case of doubt, you have to consult a doctor for diagnosis and get a complete treatment. So these are all the preventions which are given against this STDs. Next one, we are going to see the topic about the cervical cancer. Cervical cancer, very dangerous one. So here this is caused by the sexually transmitted virus, what you call it as human papilloma virus. So here this human papilloma virus, this is caused by the abnormal growth of cervical cells. The cervical cells, this is otherwise called as cervical dysplasia. Cervical dysplasia. What are the common symptoms we have? The pelvic pain. They get frequent pelvic pain and increased vaginal discharge and abnormal vaginal bleeding. These are the common symptoms you find. The risk factors is that mainly those who are having multiple sexual partners and prolonged use of contraceptive pills are the reason for getting this cervical cancer. And apart from this, we can diagnose this cervical cancer by Pap-Nicolau smear, that means a pap smear. They call it as a pap smear combined with the HPV test. So that is one diagnosis method. Another one is the X-ray, CT scan, MRI and PET scan. So all these may also be used to detect the stage of cancerous growth. Apart from this, the treatment of cervical cancer includes the radiation therapy, surgery and chemotherapy also. And you can prevent this, you can prevent it with the vaccination, Not only this, the primary prevention begins with the HPV vaccination of the girls, like the age of 9 to 13 years with the girls, and they become sexually active. Before they become sexually active, that time this HPV vaccination can be given to the girls. So healthy diet, avoiding tobacco usage, preventing early marriages and practicing monogamy are the main methods which you can avoid the cervical cancer, and also the regular exercise minimize the risk of cervical cancer, regular exercise. Another next topic is infertility. Infertility, that means inability to conceive or produce children. Even after unprotected sexual cohabitation. So unprotected sexual cohabitation, you call it as infertility. So that is inability of a man. First of all, the inability of a man to produce sufficient number of quality of sperm. That is either sufficient number or quality of sperm to impregnate a woman. That you call it as infertility in the case of male, or in the case of women, they have the inability to become pregnant. How? That is to maintain a pregnancy. That is either they become pregnant, they cannot become pregnant, or they cannot maintain their pregnancy. So this we call it as infertility. So what are the causes of this infertility? Mainly this is the tumors formed in the pituitary or reproductive organs. That is number one. Another one, inherited mutations of the genes that is coming from the generations. So and next one, which are responsible for the biosynthesis of sex hormones. So here also you have an obstruction in this case. Another one, malformation of the cervix or fallopian tubes. In some cases it is rudimentary. So in that cases you will be having the infertility, and inadequate nutrition before adulthood. So this malnutrition is also a reason for this infertility. Along with that, the long-term stress. Some women or men, they are subjected to long-term stress. So that damages the health, especially the menstrual cycle in the women. Another one, ingestion of toxins. Frequently you can see some persons, they will be taking toxins. So like the heavy metal, cadmium. So that is also one reason. And the heavy use of alcohol, tobacco, marijuana. So if they are addicted for these habits or practices, they are also prone to get this infertility. Another one, injuries to the gonads. And also the aging. This also causes infertility. The next one. Other causes. We have to find, apart from this, there are other causes of infertility, that is pelvic inflammatory disease, PID, that is uterine fibroids and endometriosis are the most common causes of infertility in the women. So this PID, pelvic inflammatory disease, you can see in the center in the picture here, there is a fibroid form here. So the low body fat or sometimes anorexia in women. Nowadays the girls doesn't eat properly, doesn't want to have a weight, they doesn't want to gain weight. So that is also a fear of gaining weight. It's a psychological eating disorder for the girls, which is called as anorexia. So that gets a low body fat. So this is also a result of infertility. And undescended testes. In male you can see the undescended testes. So here see the normal vein here, see the bulged vein, swollen veins. What do you call it as varicocele in the scrotum. This is also a cause for infertility in males. And another one, nowadays the children, they used to wear tight clothing in men. So that raises the temperature of the scrotum and affect the sperm production. Also the underdeveloped ovaries or testes, they are also reason for infertility. So the female, sometimes what will happen, this is a very critical one, what you see here, the female may develop antibodies against her own partner's sperm. So you can see the antibodies developed here. So what happens is, this is also reason for infertility. Not only that, when the males, they develop an autoimmune response to their own sperms. See the condition, the nature is given for fertility. So one, they have to develop antibodies against their own partners. Another one, the male, they themselves produce an autoimmune response in their own sperm. So these are all the symptoms which are said to be the reason for infertility. Above all, we have some women. See here, the nature, sometimes they do not bless some people. So the women, all the women are born with the ovaries, but some do not have functional uterus. So this condition you call it as Mayer-Rokitansky syndrome. So this uterus is not functional for them, they are unable to produce the ovaries or they are unable to get pregnant. So this you call it as Mayer-Rokitansky syndrome. The next one is assisted reproductive technologies, ART. So here ART means it's nothing but the collection of procedures which includes handling of gametes, embryos outside the body to achieve pregnancy. Our agenda is to achieve pregnancy outside the bodies, doesn't matter whatever be the functional system of the main person. So it increases the chance of pregnancy in infertile couples. Our purpose is to increase the chance of pregnancy in infertile couples. So next one, the topics which we are going to see under ART is, the first one, intrauterine insemination, IUI, in vitro fertilization, IVF, embryo transfer, ET, zygote intrafallopian transfer, ZIFT. The next one is GIFT, gamete intrafallopian transfer, intracytoplasmic sperm injection, pre-implantation genetic diagnosis, oocyte and sperm donation, and finally surrogacy. So all these are the one which we are going to see in the next topics. So the first one is IUI, intrauterine insemination. You can understand from the very topic, that is the procedure to treat infertile men with low sperm count. So here this is mainly for the men with a low sperm count. The semen is collected either from the husband or from the healthy donor. Then it is introduced into the uterus through the vagina by a catheter after stimulating the ovaries. So you have to stimulate the ovaries in order to produce more ova. Then the sperms swim towards the fallopian tube and then they fertilize the egg. So resulting in the normal pregnancy. Our agenda is normal pregnancy. Another one is IVF, that is nothing but the test tube baby production, in vitro fertilization. Here a sperm and eggs are allowed to unite outside the body in a laboratory. Under laboratory condition, one or more fertilized eggs may be transferred to the women's uterus, so where they may get implanted. So after the implantation, the uterine lining now that allows the eggs to develop. So excess embryos, if more excess embryos are present, that can be cryopreserved, that means can be maintained in the frozen condition for the future use. After that we have initially the IVF, so it was mainly to treat the women with the blocked or damaged, or absent in fallopian tubes. Nowadays there are so many reasons for this IVF. Okay, so now it is in common practice. Also we can see the basic step. We have basic steps, the 5 steps. First one, ovarian stimulation, egg retrieval, fertilization, embryo culture and embryo transfer. All the 5 steps are included under this. Next one, egg retrieval. You have to collect, you have to safeguard the eggs. It is done by minor surgery. See, a minor surgery is done under the general anesthesia only we are using. We are using only general anesthesia for this. And then using ultrasound guide after 34 to 37 hours of HCG, that means human chorionic gonadotropin injection. The eggs are prepared and stripped off. See, now here it is all stripped off from the surrounding cells. Now, nearly you need 10,000 to 1 lakh sperms, motile sperms needed for each egg, and then the zygote is allowed to divide up to the 8 cell stage, what you call it as blastomere. Okay, so this blastomere is the one which we are expecting to catch. And then this is transferred into the uterus for successful pregnancy. After that, the transfer of an embryo with more than 8 blastomere stage in the uterus, you call it as ET, that means embryo transfer technique. So now it is ready. After that, the cryopreservation, that is the excess of eggs which are produced functionally were stored in the frozen condition more than the embryos than needed. Okay. Then this can provide an additional opportunity for the pregnancy. And a frozen embryo transfer, you call it as FET. Now here you can see without undergoing another ovarian stimulation, and the retrieval process is made possible with the help of cryopreservation. The next one is ZIFT, zygote intrafallopian transfer. Zygote intrafallopian transfer. So here also the 8-celled blastomere stage is transferred to the fallopian tube by laparoscopy. Here it is done by laparoscopy. The zygote continues its natural divisions. What are all the next steps given? So it is continuing as well as in the uterus where it gets implanted. Next one, the IUT, that means intrauterine transfer. Here also more than 8 blastomeres is inserted and then into the uterus to complete its further development. Very simple. And the next one is GIFT, gamete intrafallopian transfer. So transfer of an ovum collected from a donor to the fallopian tube. So the ovum is collected from the donor and this is introduced into the fallopian tube. The eggs are collected from the ovaries and placed with the sperms in one of the fallopian tubes for the fusion. So here the zygote travels towards the uterus and gets implanted in the inner lining of the uterus. So this is GIFT. Next one is ICSI, that means intracytoplasmic sperm injection. So intracytoplasmic. So the very word, the very term tells you it is cytoplasmic injection. That is, in this method only one sperm is injected into the focal point of the egg to fertilize. So here the sperm is carefully injected into the cytoplasm of the egg and the fertilization occurs in 75 to 85% of the eggs injected with the sperms. So this is ICSI. The next one, the zygote is allowed, here also the zygote is allowed to divide to form the 8-cell stage. So you can see in the picture, the 8-cell stage here it is formed and then this is transferred into the uterus to develop a protective pregnancy. Our agenda of ART is a protective pregnancy. Next, finally, the surrogacy. Surrogacy is a method of assisted reproduction. Here it's an agreement. We call it as an agreement where a woman agrees to carry a pregnancy for another person who will become the newborn child's parent after the birth of the child. So that is the in vitro fertilization, that means IVF embryos are created in the lab and then this is transferred into the surrogate mother's uterus. Okay, next one, the male infertility prevention. How to prevent the infertility in males? The condition, what do you call it as? Azoospermia. Here, this is defined as the absence of spermatozoa. The spermatozoa are absent in the ejaculate semen on at least 2 occasions. And this is observed approximately in 1% of the population in men. So how to avoid this? For this we can go for a process, what do you call it as microtesticular sperm extraction, the TESE, that is this microsurgical sperm retrieval. We are retrieving it from the testicle. So here you can see the testicle. This, a small middle incision is given in the scrotum through which one or both testicles can be seen. So after that, under the microscope, the seminiferous tubules, you can see from the seminiferous tubules, they are all dilated and a small amount of the tissue is taken out. A small amount of tissue is taken out where the active sperm production are removed and this is improved. This is improved for sperm yield compared to the traditional biopsy technique. Next one, detection of fetal disorders. Detection of fetal disorders during early pregnancy. That is, the first one we find with the help of ultrasound scanning. Here you don't find any known risk other than the mild discomfort due to the pressure from the transducer of the abdomen or the vagina. So here ultrasound done. You can see the picture here. Another one, there is no radiation here during this procedure. This ultrasonography is usually performed in the first trimester. Dating, determination, number of fetuses and for the assessment of early pregnancy complication. Only for these 3 points this is done. Ultrasonography is done. And amniocentesis, the next method. Here this involves taking a small sample of the amniotic fluid that surrounds the fetus to diagnose the chromosomal abnormalities in the fetuses. So here this is generally performed in the pregnant women between 15th to 20th of the weeks by inserting a long thin needle, a micropipette you call, and in the abdomen, and from the fluid is sucked into from the amniotic sac to withdraw the amniotic fluid. So actually we can find the cells shed from the fetus are found along with that. With that we are able to find out the chromosomal abnormalities on via the serological test. Next one, chorionic villus sampling, CVS. Here itself you can find the CVS, that means the prenatal test, CVS, prenatal test that involves taking a sample of the placental tissue to test for chromosomal abnormalities. You can find in the picture, only a sample is taken from the placenta. Finally, we have the fetoscope, which is used to monitor the fetal heartbeat and other functions during later pregnancy and the labor. So actually the fetal heart rate is between 120 to 160 beats per minute. So the abnormal fetal heart rate or the pattern, that means that fetus is not getting enough oxygen, and that indicates the feticide. That means the other problems when it is not getting enough oxygen. So this indicates the problems here, feticide taking place. So how to find out? We have a device, what do you call it as Doppler's device, a handheld Doppler's device. This is handheld Doppler's device which is used during the prenatal visit to count the fetal heart rate. And another one during labor. During labor, the continuous electronic fetal monitoring is often done with the help of this Doppler's device. So finally, health reproduction, legally checked birth control measures and proper family planning program, they are all essential for the survival of mankind. So with this I am completing the third lesson. Hope children might find easier to follow my lecture. Thank you so much.